Hi, Dr. Joe here to talk a little bit about tuberculosis. This is in the Lancet, and there's multiple things that are talked about. And I began to talk about the whole thing in a different era in Detroit when I was at Henry Ford Hospital. It was known then, and I was told very carefully, that in the beginning of the last century, way back when, in 1900, the Germans had done very well by using vitamin D to make things really well. And they basically cleaned out TB from all of Europe. Unfortunately, went on to win less of a war from all the other things that were going on. But that's when a lot of it began in terms of what we did. And we were told at that particular time 50,000 units of vitamin D is what you should do every day for everybody. Now we have the Lancet coming out with some more of this, and they talk about the battle. They talk about how it's all changing, world TB. There's about 3 million people who probably have TB, and nobody knows who they are. It's sort of funny. It's a little cough, and nonetheless, it's very dangerous. Death rate is skyrocketing right now. So a lot of people you see having a little kind of cough in or around your children or anything else, advise them to be seen. Advise them to be having chest x-ray to figure out what it's all about. There's all ways to make a diagnosis, but we've got to hurry because this is not right. A guy named DeLuca, he was at Henry Ford Hospital for a brief period trying to learn a technology that I had mastered, and the vitamin D was very important in his life. He did so many other things that were really involved in this. And so he is involved in a role of advocacy in tuberculosis. So this is really all hands on deck kind of thing, that this is a big deal. As I talk to this, a lot of patients, a lot of them say, you know, I worried about that cough that I heard from whatever it is, and it's time to worry about it. It is your time to worry about it.